Welcome back. This is Ivan with your November question of the month. The question of the month for November is as follows. The current political climate has brought a lot of fear and uncertainty to New York. Uh, so, what are the most worried about when it comes to your healthcare, and what are you most grateful for? So, let me first say New York is a wonderful state to live in because we do take care of people with this disease. There are many programs and many things that can help make sure a person gets the medical treatment and gets the medicine that they need in order to become undetectable, live a healthy life, and continue. Unfortunately, due to the political climate right now in our federal government, and with the passage of this big beautiful bill, many people around the country, and the most vulnerable, are the people who are in most danger of losing their health care. And people with HIV and prevention, and who are trying to prevent it from going on, are losing a lot of funding. That is the most fearful thing that I have. Because I did grow up in a time where people couldn't afford their medications, people were dying left or right, and we didn't have the advances that we have today. Unfortunately, we're a victim of our own success because now people don't realize how bad HIV can be. We work tirelessly to make sure that we get people in care and get them to work to take the medication that they need. We meet people at where they are at. We also try to educate people to make sure that they know that PrEP and PEP are there for them. And we also, so they could get the medication to help prevent HIV. Prevention is the key to make sure that this virus and that this epidemic gets resolved. But under this government, we are losing lots of money for prevention. Why? Most people won't say it, but I will. To give the 1%, the richest most people, a permanent tax cut, also to big business. While who's hurting? The people that need it the most. Let me give you an example. Most HIV medications are about $3,000 per month. Most people can't afford that. And if they can't get their medications, people will lose the battle. People will not be undetectable and will be able to transmit the disease. But yet, we'll have the 1% get a nice tax break in big business. What angers me is that most Americans don't realize that we're the ones funding this research and this medications. And then when they find these, Big Pharma put a patent and gets so much money out of it. And we don't even get a dime for funding that research. I'm scared that if we continue this path, people with chronic disease like HIV, diabetes, and all this are not going to be able to afford their medications. Will we have to either decide whether to pay rent or whether to afford medication, whether to eat or whether to take their medication. That shouldn't be in a country as wealthy as ours. And most of us know that healthcare is a right and not a privilege. New York is in the forefront of fighting against the epidemic. But if you see which states lead in HIV new transmissions, there are Republican-led states, especially in the South, like Mississippi, Alabama, Florida. That is a bad thing. I know people have their religious beliefs of certain things. I applaud that. But part of being religious and part of the teaching of religion is compassion. I'm scared that we're going to go backwards to the days where the epidemic was killing people. When you got your results, you were told to go home and set your affairs in order. Because if you live 6 months, that will be a lot. We've come so far. And yes, we're not perfect. But healthcare is not a privilege. Healthcare is a right for humans, for us. We can have many differences, but I truly don't believe that we want to go back to the days where hundreds and thousands of people were dying. Some by themselves. Some, the only people that were there were the nurses and the nurse doctors and the people who volunteered to be there because their family turned them away. It is not a death sentence. But if we continue the way we are, and we continue getting people off medical insurance, it will be. And that is wrong. I am grateful for a state that is trying to end the epidemic, who far exceeds more than the people know. But we need to do more. This is not about Republicans or Democrats. This is about life or death. Whether we want to continue people dying, whether we want people to continue living healthy, or if we're willing to look away until somebody in your family, until somebody you love gets hit with this disease. Look, I'll be honest, I'm not a saint. But if PrEP was around when I first was diagnosed, before I was diagnosed, I would have taken it. But it wasn't. PrEP is for everybody. It's to help you make sure that you do not get this disease. And the medication that I take, yes, it has its side effects and its bad things. But the alternative is to become weaker and sicker and die when I can prevent it by taking my medication. But I can't do it if they keep cutting the help that we need to give the rich and the big corporations a nice tax break. The middle class and the poor are paying the most when we don't have that. So, with all of that, I am worried that we will go backwards. I am worried that I won't be able to afford my medication. That they're putting all these barriers and they are putting people in danger. Because whether we like it or not, people are going to do what they need to do to survive. Whether we like it or not, people are going to be sexually active. And it's becoming younger and younger. Abstinence is not always the answer. We should teach it. We should try to make sure that people know about it and that is one of the things that we're doing. But we also should make sure people know what is out there to help them prevent from certain sexual transmitted diseases. And I'm not talking just about teenagers and young adults. I'm also talking about people over 50. Because whether we like it or not, just because you hit a certain age doesn't mean you stop having sex. I'm worried that more and more people are going to be diagnosed. And if we continue to cut the programs and cut the Medicare, Medicaid, and the programs that help us fight this disease, you will see a rise in numbers, but mostly you will condemn a lot of people to death. And it's not a gay man's disease. It's not just a drug addict disease. It is a universal disease. Just because you haven't been hit by it, or just because you don't think you know somebody who is positive, doesn't mean that it's not out there. For many years, people hid the fact that they were positive because of the stigma, and they still do. because they don't want to be known for that disease. I'm worried that we're going to go backwards. And I remember those days, and I do not want to go backwards. We can join our voices together and make sure that people get the treatment that they need, get the prevention medication they need, and we can join together to end this epidemic. We can do it. We've seen the results when we do it. I'm grateful for those results. I'm grateful for campaigns like this and for the campaigns for PrEP and everything. Now, more than ever, we need to unite our voices to not go back to those days. So, if you don't want to go back to those days, become an advocate. You don't have to be in the forefront. You can be calling your congressman, your senator. You can call the White House. You can call other areas and make sure it's not just a federal government thing, but also a state thing, where the Assembly and the state Senate will be voting soon on a new budget. And we got to make sure we have those voices to continue this fight, to continue the progress that we've done. It's easy to ignore the problem and say that it doesn't exist. But when it's you that are being hit, when it's a loved one that is being hit, then that's different. We all deserve health care. We all deserve health insurance. This is not a Republican or Democratic thing. It's a human and compassionate thing. I hope you join me with this, because the next few years are going to be tough. But if anything has been shown in the past about our movement, is we're willing to take those fights to where we need to. And I will continue advocating to make sure we continue to do the right thing. Not just for me, not just for my friends, my colleagues, my spokesmodel, but for you. So you won't have to get that diagnosis. You won't have to feel your world shattered. You won't have to say, I'm not worth living anymore. Because you do matter. I matter. And our healthcare is the most thing that we can do to help each other. If you're newly diagnosed, there's many resources. Get the help. Don't feel like you're alone, because many of us been through that. Find one of us. Find a group. We will listen. We know what it's like to be there. I'm grateful for the HIV community that I found in this year. I'm grateful that I can speak out to save as many people as I can from getting this virus. With that, I will say, never forget that you matter. And if you ever need me, I'm here. Till next time.